This presentation is about lethal or worrisome rhythms that would require immediate medical attention. The first one is ventricular tachycardia. The rate is usually between 100 and 200 beats per minute. The rhythm is regular. There are usually no identifiable P waves, and if they are present, they are not related to the QRS complexes. There is no PR interval, and the QRS complex is wide, greater than 0.12 seconds. It is very characteristic, like the EKG strip that is below. They also refer to it as shark fins. Just look for that wide, repeating, similar-looking QRS complex. That's going to have a rate greater than 100, and it makes you think ventricular tachycardia. The next one is ventricular fibrillation. There's no measurable rate. The rhythm is irregular. There are no P waves. There are no PR interval. And the QRS complex is chaotic. It's wide. It's bizarre. It just wanders. Notice the difference between the ventricular fibrillation and the ventricular tachycardia. The tachycardia, at least the bizarre waves looked similar. That does not happen with ventricular fibrillation. Asystole. With asystole, there's no rate, there's no rhythm, there's no P wave, there's no PR interval, and there's no QRS complex. You might see a little bit of deflection from a baseline, but that is not related to anything. That does not represent electrical activity at all. And finally is pulseless electrical activity. This one, the important thing is assess your patient. The strip can look like any rhythm, except for the last three, the ventricular tachycardia, ventricular fibrillation, or the asystole. The important thing is no matter what the strip looks like, when you assess the patient has no palpable pulse.